Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, other than the recession, but actually very much part of it is health care. The costs are rising, the coverage is diminishing. We have some experts who are going to fill us in on the latest trends in health care. And then we promised you a labor update. We talked about something called the Employee Free Choice Act, card check as it's also called. We're going to get into that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we're in a recession. Everybody knows this. The recession is now technically about a year old. We've got enormous problems in health care, particularly as folks can lose their jobs, they lose their health care coverage. Rising costs, a whole series of problems. We couldn't have a better duo. I'm going to call you guys a duo on the program to talk about it. Joining me, as sometimes is the case, is Michael Fiaschetti. He's a senior VP at Highmark, and as often is the case, Dr. Robert Muscalus. He's the medical director. He used to be the state's top physician. What did I call you? The top doc or something like that?
I think you did, yeah.
For all those years. But look, I want to thank you. It's hard to talk about a subject other than, do you have a job, Mike? Do you have a job? And with it comes health care, right? There's probably nothing more important right now. Let's talk a little bit about what you see in this economy with health care. Talk either about the costs that you see or folks losing their jobs, and what are employees doing?
Well, Terry, I think you hit it on the head. Health care, next to the economic meltdown that we've suffered, health care is probably the biggest issue. It's now 16.5% of the gross domestic product. It's predicted to grow to 20% by 2015. It's outpacing inflation by 3 times. So, and right here in Pennsylvania, that's the case. We're seeing, because of the economy, employers are downsizing, they're cutting costs, and people are losing health insurance, which is forcing them to either take individual coverage or go uncovered. So it's a real problem. The uninsured ranks is growing here in the state.
I've talked to some folks, just anecdotally, who tell me they're paying $300 and $400 a month, out of their pockets to get some kind of coverage. Is that unusual in this economy today?
Not necessarily. Obviously, depending upon the arrangement, the size of the insurer, the relationship they have, contracts they have with the insurer, some of those prices can vary.
Yeah, what we see, Terry, is on average, employers are paying about 70% of the cost of health insurance premiums. That's what we see here in the state of Pennsylvania. An average, per employee, the average is about $8,500 a year. For a family employee, it can be as much as $12,000, $14,000. For an individual, $5,000, $6,000, $7,000. So for someone to pay $200 or $300 a month out of their pocket, that's not totally unusual.
Yeah, I used to point out that in some cases employers were paying more for their employees' health care than the employee was paying for their home mortgage. I mean, think about that a minute. I'm talking about per year. That's pretty startling that we've come to that. Well, Bob, let me talk to you about something else that I think is pretty important. And I know you and I have chatted about this over the years. Governor Rendell wants to, he's had several plans to cover a lot more Pennsylvanians. We can talk about that. President Obama wants to do that. All the surveys that I've seen indicate that the American people want something like universal coverage. Where do you think we stand on all of that? Do you think this economy is going to push us more towards covering more people? And it can be done in a variety of ways. What do you think?
Well, I think everyone would love to see all individuals have access to health care. Obviously, it's in the details. How do we get this accomplished? And the current economic environment is making it more difficult. Employers, while downsizing, want to continue to have attractive benefits to be able to maintain their workforce. But one of the things that we're seeing occur is, historically, employers looked to us, the insurers, through our contracts with facilities, our contracts with doctors, and our disease and care management programs to try to control costs. What we're seeing now is a shift where employers, in addition to putting demands on us, are also looking to their employees to take better care of themselves, to identify issues early on so that small problems don't become big ones and more costly ones later on.
Yeah, Mike, the preventative aspect of healthcare is sort of the burgeoning, I put it, the field in terms of healthcare delivery. Am I right about that?
Yeah, clearly that's a big trend. Over the last 3 to 5 years, we've seen many employers adopt a model whereby they ask their people to be involved in their own health, to do more to take care of themselves, and they're actually adjusting benefits based on whether people do that. They're adjusting their contributions to their health. The state did that.
Yeah. Do you think does that make sense to you? I mean, is that a viable, is that a reasonable alternative?
I think it is a reasonable alternative. I think if you look at the healthcare system, we're spending, I mentioned we're probably at $2.4 trillion in health care. It's estimated that $600 to $800 billion is wasted. Some portion of that is due to unhealthy lifestyles.
Well, we're going to go to break.
We've got to incent those.
We're going to go to break, but you make a good point. I mean, at some point, all of us have to take a lot greater responsibility for our own health care. We just can't simply eat too much, gain too much weight, let our blood pressure, and then all of a sudden run to a physician and then say, well, all this is going to be covered by an insurance, by an insurance carrier just because we've had these unhealthy lifestyles. Now, you're doctor, you're shaking your head.
Absolutely.
All right, we'll be back. We're going to continue this discussion following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're chatting about healthcare trends with two of, I think, the state's leading experts on healthcare matters and trends in healthcare, Dr. Robert Muscalus and Michael Fiaschetti. Both are with Highmark. Doctor, let's talk about what are employees doing in terms of encouraging their employees to get into these better regimens with healthcare to avoid what Mike was talking about a moment ago.
Terry, we're seeing a variety of things at both the regional level in Pennsylvania and also at the national level. First of all, we have data now that shows implementing wellness programs and doing these types of things does in fact have an impact on trend. Never claim to lower your costs, but we can have an impact on the rate of increase. We see variation from providing financial incentives for completing things like health risk assessments or STEPS programs that require things like annual physical exam and some educational programs. The other thing we're seeing are employers saying, you know what, Terry, next year we're going to keep your health care costs flat, but in order to maintain that flat level, we want you to complete a program this year. If you don't, then you will have a higher rate.
There's a lot of, but look, a moment ago we were talking about, lots of people want universal health care. We talked about, President Obama has a plan. Governor Adele's had at least 3, over the last couple of years. But isn't there a relationship? I mean, if employers have a plan, but what happens if you don't have it? So where do you think all of this is going to go?
Well, I think that's an important question, and certainly I don't think Rendell or Obama or anyone in the administrations would argue that we can abandon the employer-sponsored plans the way they are now. We still have to have an employer-based system, but we need a broader system to cover the uninsured. And we support that. We really do. The concern we have is that it's done in a way that it doesn't exacerbate sort of the problems of what we call cost shifting, because today the government programs don't always pay the cost that it really that's really incurred to care for people. So those costs get shifted to.
I mean, none of the plans that I've seen call for abandoning I mean, you can patch it up and you can work within it, but the so-called single-payer plan is just not likely to fit into the culture in our country. I mean, the culture of healthcare and access. And am I wrong or am I right?
No, I think you're right. All politics is local. All healthcare ultimately is as well local. And to try to implement a universal plan would be very, very difficult.
Yeah, we do have this sense about how important our own physician is, about picking our own physician. Now, of course, we still have, now it'll be a growing number. Maybe 46 million nationally, and I see different numbers in our state, maybe 800,000. without any health care coverage. And both Obama and Rendell, national state, have argued that they're going to move on that, after they sort of deal with the recession. Let me ask you something about Highmark. You are having a retail store. Is that a new? What's that concept about? I want to give you a chance to talk about that.
Part of what we're trying to do is get much closer to the end user of healthcare, the consumer. That's part of our consumerism strategy. And we believe by having a retail store, we can connect to the consumer.
What would you do in a retail store? Tell our viewers.
We'll do several things. We will actually sell to individuals. Many individuals don't know where to go to ask questions about health insurance or to get in health insurance. There are a lot of individuals who have to buy health insurance on their own. So we'll do that. We can also use that to inform people about health care, about health and wellness, to do promotions.
So in other words, it won't be just to sell. I mean, obviously everybody in the business world, you want to sell, your product, but you're also going to provide a genuine service to people in terms of coming in and getting good information about lifestyle and the things we're talking about.
Absolutely.
Right?
They will be as much education centers as they are sales centers, but we have to connect to the end users and get them more information.
Is this a first for you all?
This is a first.
Yeah, and let's see. Pittsburgh, Mechanicsburg, is that it?
That's correct.
Is that where you're going to start?
That's correct.
Well, we'll have to see. Go ahead.
Terry, I'm sure all of us have had experiences where we make a phone call and we finally get someone and we say, great, we finally get a person to talk to.
Oh, yeah, we all know about that,
exactly.
right?
And this is a way for us to have individuals who can speak to consumers and address not only their insurance issues, but other things related to their health.
Now, you can't tell me you wait on the other end of the phone.
Sometimes
Everybody
I do.
knows you. But anyway, look, I do want to go to something else. There's this roiling debate about what's driving healthcare costs up. And it's probably a bunch of things, but let's talk about what is it that's really driving. We've got technology out there. We've got increased, in some cases, more expensive kinds of operations being done. But then you all face limits on what you can pay because the federal government controls so much. Who wants to get into that mess?
Yeah, no, it's a complex set of reasons. First of all, we do have an aging population, and older people use more health care. We have adverse lifestyles. We talked about that. Obesity is causing something like 300 or 400 billion in excess illnesses, so that's an issue. On the provider side, there are areas where we have too much capacity, and there are areas where we have not enough, rural areas and so forth. So we have issues there. Providers are seeing huge increases in cost. Hospitals, for example, nursing staff, other medical professionals, their technology costs are skyrocketing. And like everyone, everybody's pension funds have taken a hit.
And before I let you go, we're still back to the same thing that you and I have chatted about for a couple years, and that's defensive medicine. I mean, I do understand you go in to see a doctor, not quite sure. 10 years ago, maybe he wouldn't prescribe these 3 other tests, but now you better go ahead and do it. I mean, does that still play a role in the doctor's decision?
Yeah, it sure does. And not only that, but also when you have national protocols being determined, physicians now today have to be thinking about what's recommended, what's required, so that in the event something would ever go wrong, they have the documentation to show that they did everything as it was recommended.
All right, this is a great update. Before you go, I do want to ask you one other thing. We're going to see all these changes, we think, or there's going to be a lot of proposals, so I want you folks to come back in 6-8 weeks if you can fit it into your schedule, because what I want to talk about is what's Obama doing, how is that progressing, and Governor Rendell is going to push his plan to cover more Pennsylvanians through adult basic. We won't get into all that now with you, but these are pretty important things that dramatically could affect the delivery of health care.
Terry, we'd love to talk to you about that. We'd love to tell you the good, the bad, and the ugly of the proposals that we see.
We're going to hold you to it.
All right.
All right, when we return, turnaround is always fair play, balanced programming. We're going to get organized labor in here. We're going to find out what the problem that average workers are having. We're going to talk about something called card check and what all that means. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, to say that it's a bad economy is an understatement, and we've got some folks here from organized labor that want to chat with us about what's going on with the workforce, what's going on particularly in state government, with some comments Governor Rendell made recently, and then we obviously want to chat about the Employee Free Choice Act. Joining me is Karen Black. She's the Executive Assistant to the Executive Director of AFSCME, union that represents a lot of state employees. Kathy Jellison, she's right across. I'm pointing at her. Forgive me for doing that. I'm not even angry, and I'm pointing at you. She's the President of SEIU, Local 668, the Pennsylvania Social Services Union. All right, let's get into it. No more titles. Karen, I want to start with you. Average working person, tough economy, layoffs. What are you hearing out there from your members?
Well, I'm hearing that times are tough, and that's not anything new for anyone to hear. Yeah. A lot of employees are having trouble making ends meet. You know, the cost of groceries are going up, the cost of gas, the cost of oil and heat and everything else, and their salaries aren't raising quite that quickly. And when they're being asked to give back a portion of their salary, they just can't do it, and they're scared. I mean, they're very nervous.
I mean, this seems to be affecting a whole range of people, Kathy, across a bunch of demographics. You lose your job, however, you lose your health care. We just talked about that.
Right, and what we're seeing is our folks, we work in public services, so our folks work in the unemployment offices, and when you have 170,000 people applying for unemployment in 1 week, people that you would never expect to walk into an unemployment office, these are professionals. And also in our welfare offices where we represent folks as well, record numbers of folks applying for benefits, people that you would not see, not just the poor. You're seeing people that are losing their homes. They're losing middle class America.
Even college-educated folks. This is a tough economy. Look, I want to ask you both of you. Governor Rendell famously now made this argument about don't whine over the budget cuts. Now, I notice you got whine, scream, and holler. Now, you get to explain that. Go ahead. Can you see that? Can you? I don't know if you can pick that button up. What's that about?
Well, the executive director, David Philman, the executive director for AFSCME, did make a comment, was quoted as saying, I will whine, I will scream, and I will holler if you're talking about taking jobs and money away from those employees that I represent. So
I wanted to ask, there was a question asked by a reporter last week, and the reporter said, now, if you get $7.6 billion, right, and that's what might be in the stimulus package for PA, right, for Pennsylvania, why all this talk about the state being in such fiscal hardship? So, but yet the governor has said that they may do furloughs, they may do layoffs. There's differences, between layoff and furlough. You all know that better than anybody else. Well, what's been the reaction from your union about what the governor said?
Our members are quite angry about it. We are going to whine, scream, and holler as well, but we gave up 2.5 years of pay. We took concessions to help with the budget before. We started paying into our health care to help with the budget. And it seems like business as usual for the governor, but when it's time to make cuts, he always comes to public services. And that's the place they can least afford to cut, is in public services, especially when the economy is this bad.
All right, we're going to take a quick break. I want to get into this Employee Free Choice Act. It's controversial. Congress may take it up sometime this spring. We'll find out about that after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School. bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. Equal time provision. We talked about the Employee Free Choice Act with some folks from the business community a couple of weeks ago. I want to start with you, Kathy. Explain Employee Free Choice Act to our viewers.
Well, in 1935, Franklin Delano Roosevelt passed the Wagner Act. And what the Wagner Act did was it gave a choice, and it put the choice in the hands of the workers, whether they would have an election or they would get a majority of cards to join a union. And what happened for the next 35 years was that we built the greatest middle class in the world. And somewhere in the early 70s, around 1974, the Supreme Court did a ruling that changed that. And what changed was there were now delays by the employers. The employers began to intimidate and fire workers when they became activists and wanted to join a union. And so the Employee Free Choice Act actually it does what it says. It puts that choice in the hands of the workers, whether or not they can have an election or do a majority of cards. And it stops the intimidation and the delays in getting a contract. And the other thing that it does is it provides for bargaining of a fair contract so that people can get a first contract. They can sit down at the table and actually bargain for their wages, for their health care, for their retirement. And, you know, when you have employers that are making 300, 400, 500 times what a worker is making, what better time than to try to rebuild the middle class and repeat history than now?
A couple of weeks ago when we had some folks on, they talked about the disadvantages to the bill. And what is it that you would say in response to the critics of the bill in terms of what your position would be in terms of the facts? Or what are they saying that you think is inaccurate?
Well, you're hearing a lot about don't take away my free choice for a secret ballot. Don't take away my ability to go to election. And the Employee Free Choice Act does not do that. The Employee Free Choice Act clearly allows people to do exactly what they do now, which is upon 30% of the members expressing interest go to election, or upon 50% plus one, a majority of the bargaining unit, to go for recognition, which means I have enough cards and you need to recognize me. That can actually happen today, but if it happens today, the employer has to agree. With the Employee Free Choice Act, the employer would not get to veto the card check, and that's what the 50% plus is. So it adds another aspect.
We have about 30 seconds. Do you think that President Obama is going to bring this up? I mean, what's your sense? Obviously, got to get over this recession, but there's going to be a vote in this on Congress, I would think, before long. You'll go agree. Is that a yes or no? You hope.
Well, I mean, we're anticipating. We don't know what he's going to do. We're hoping that it's going to go. Yeah.
Thanks for the update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well, and I'm talking fast.